This is the Registered Behavior Technician course presented by Shaza Attar. The course content was created by Shaza Attar and is the property of Autism Therapy and Training, Inc. All rights are reserved. This training program is based on the Behavior Analyst Certification Board 2018 RBT Task List 2nd edition and is designed to meet the 40-hour training requirement for the RBT credential. The program is offered independent of the BACB. Remember, in each class, we will have our active listening, a quiz, and a competency assessment. Hello everyone, and welcome to today's topic on successful teaching practices. This class will take everything that you've learned and focus on applying it. One of the challenges with an online program is getting the opportunity to practice something so that you're able to actually do it. Reading about something or learning about a topic can give you the terms that you need and understanding, but the actual implementation can be tricky. Throughout this program, I've given you opportunities to practice some of the things you'll be doing as an RBT. So in today's class, I want you to see the concepts we've talked about, like DTT and error corrections and so on, put it into action, and I want you to give it a try at home. Practice these steps, practice with a coworker, friend, or with a client if you're working in that setting. For today's class, you'll need a few things. 1 is your imagination. 2, some material. I want you to bring a timer or stopwatch, tally counters. If you don't have tally counters, then what you could do is keep count on a piece of paper and track them that way. You'll need some letters. If you don't have any letters, that's okay. Take a piece of paper and write the letters on them. You'll need the letter A, B, C, D, and E. Lastly, you'll need about 5 objects: a spoon, a fork, tissue or toilet paper, a phone, and lastly, if you have these items, great. If you don't, pause the video, gather your items, and come back. Remember, what we're about to do could be on the quiz, and you'll need to go through the experience to get the correct response. Okay, first thing, let's review intensive trial training or discrete trial training. You want to remember to capture your learner's motivation first and foremost. Select a few reinforcers and place them on the table. Let your learner select the reinforcer. Once you've established the MO, then you can start teaching. But remember, you need to have those attending skills. The learner needs to orient and attend to your voice. They need to be able to stay in their seat. They need to keep their hands down and not touch the material or grab the reinforcers. You also want to ensure that the learner is looking at you. You don't need to say, "Look at me," but you want to have that eye contact while teaching. You also want to ensure that your learner attends to the stimuli on the table. Before each trial, be sure you do these steps before you run into the actual teaching. When teaching an imitation skill, you want to start by presenting the SD, such as do this. Prompt the correct response, run a transfer trial, then your learner needs to copy the action. Here's a video model to show you. When we want to build up a successful session, it's important to be prepared. And, I talk about being prepared, and that's one of the tasks of an RBT, is to ensure that they come into their session ready to go. And some of the things that I like to have, and I've mentioned this before, is your stopwatch or your timer, that you have some tally counters. I like to have 2. I like to attach these onto a belt so you have one for prompted and one for independent, and you have that's accessible to you. The other thing that you want to be sure that you have and that you've done is that program, that skill acquisition plan, or the program sheet as I call it. And you want to have that on a clipboard or in a folder that is somewhere where any therapist can really get to it and read it. And it's important from time to time that you guys do go through it. You read what the objective is, you read the correct response. And then you read the teaching procedure to ensure that you're running it correctly. And so that is something that you would have. If you had a program that was specific to having like teaching material, then you want to be sure that you've prepared that in advance as well. Don't create targets and whatnot while you're working with the learner. So if you're printing off sheets or if you have certain things that you have to create, be sure you do that prior to getting to that session. And again, having it in a folder on the clipboard, somewhere where it's neat and tidy is important. So, I have that. I've got my timer. I've got my my tally counters. The other thing that I want to make sure I have is reinforcers. So I might have things like books and balls and other things that I might have in a bin of activities for the learners that I'm going to be working with. Again, you want to have those so that you can assess the motivation first. And then, of course, having your program material and maybe your high probability cards. And so I have those ready to go as well. And each learner, the way that we set it up here at the center is each learner has their own because they all have different skill sets and they're all at different levels. So we write them down and then we're good to go. So the first thing that I'm going to model here is one, capturing that motivation and getting ready to go. And then I want to teach the skill. And then if an error occurs, I'm going to run an error correction. So I'm just going to show you the first one. And I want to, again, it's all about having a flow. It shouldn't be choppy. It shouldn't be, that you're thinking about things. You just want to get that flow as a therapist. And that's something that you would be working on as you day in and day out. So let's get started. So the first thing that I'm going to do is I'm going to assess the motivation. I'm going to place things. I like to place about 2 or 3 things that I know that the learner likes based on the preference assessment. So I've assessed, let's say, books, and I've assessed, balls and other activities. So I can put those now in front of the learner, allow them to select the item that they want to play with possibly after this trial. So here they are on the table. The learner is now going to select one of the items and begin playing with it. So I'm going to let them make that choice. Now, if they don't make the choice, then I might, bring them a little closer, or, if they really don't like this, then I'm going to pull out a different item or so until they make a choice. So let's see if they make a choice. Perfect. So it looks like they made a choice, and that's my assessment before I go into my teaching trial. So now the other items I can clear away. I'm going to put them just on the floor beside me, and then I'm going to give them an opportunity to interact with the item for a little bit, and then I'm going to go into the program. And I've got my high probability cards ready to go. I'm also going to put out some receptive and tact cards on the table for the learners. So we might be working on those numbers. So remember I said get those numbers ready. And I have different numbers here, so it doesn't matter. I know I told you to get some actually letters. You might have some numbers too, so that's good too. And so I've got my picture cards here. I've got my high probability cards, and now I'm going to start teaching. Can I have a turn? Thank you. Good job. All right. Say ball.
Ball.
What number is it?
15.
Point to 17. Show me the mouth. Good. What is he doing?
He's playing.
Very good. All right, so there's my trial right there. I went through a couple of picture cards and high probability. Now, the last thing that I want to do when I've ended off my trial there is to reinforce the learner. So I'm assessing the motivation first. I go into my teaching, and then I'm going to reinforce at the end of that. Another thing to really pay attention to is the learner's ability to attend to you and to look at you during teaching and to sit properly and not touch teaching material. You don't want them touching your picture cards or doing, scattering them or whatever it may be. So pay attention to that. And if they are, playing with the cards, then you want to speak to your supervisor about working on those attending skills first. So now I'm going to go into the imitation, and I'm going to do clapping, and again, I'm going to prompt it. I'm going to then do my transfer trial and then reinforce. All right, my turn. Good job. Show me the chair. Find the number 15. Where's the mouth? Do this. Do this. Good job. Very good. So you can see I had assessed the motivation prior to. I went through my high probability cards and I ended off on that imitation skill, which is the one that they are currently working on, and then I reinforced after that transfer trial. Now suppose your learner made an error. Use an error correction. Here's a video model. Now before I get started, I'm going to reassess the motivation because the motivation may have shifted now. So I'm going to place some items on the table as I get my cards ready and I start setting up my next teaching activity. I never want to leave the learner down doing, leaving them with downtime doing nothing. I always want to make sure that they're selecting something. All right, so now that my learner has picked something, I can now clear the table from the other reinforcing items. I'm going to put that down. I'm going to change up my cards and then go from there. And so now I'm going to work on the error correction. So she's going to get it wrong, and watch how I do the steps as a whole. All right, can I have the toy, please? Thank you. I'm going to put it right here. Say pizza.
Pizza.
Show me number 15. Where's the mouth? Say dada.
Dada.
Do this. Do this. Do this. Do this. Good. Nice work. So as you can see, when I did the error correction, first I brought her hands down so that I don't chain the incorrect response, and then I restated the SD. I prompted it immediately, and on the transfer trial of the error correction, I provided a slight prompt. So I brought her hands together and allowed her to engage in the correct response. Very good. Let's go into receptive training. You'll place items or pictures on the table. So I asked you to gather some items. Let's do it together. You'll present the SD, show me. Now remember, you want to vary these SDs. You can say show me, touch the, find the, and so on. Prompt the correct response, then run a transfer trial. Don't forget to reinforce your learner's correct response. Here we go. Let's give it a try together. All right, so here I'm going to now assess the motivation. I'm going to move on to the receptive skill. So I'm going to assess the motivation for this trial. She's picked an item. That's great. I'm going to remove my other ones as she's playing with her item. That's good. I'm always making sure that my learner is engaging in appropriate behavior at the table. They're not engaging in self-stimulatory behavior. They're playing. And I'm also keeping an eye on the learner so that I'm not turning my attention away from them and they fall off their chair and they hurt themselves. So I'm constantly paying attention to the individual. So my turn. So now I'm going to do the receptive skill. Say brother.
Brother.
Do this. Do this. Point to the star. Good. Do this. Point to the star. Good. So now you can see, here you go. You can see that I went in and I prompted it. I used a gestural prompt. She engaged in it following my behavior. Again, I always want them to do whatever it is that I'm prompting them to do. So here she pointed. And then on the transfer trial, when I was trying to do it, I noticed that her finger did not leave the picture card. So I had her engage in a high probability task. So I just told her to clap her hands or do this. And then I restated the SD for her to go to the star. And then she did it correctly. So now I'm going to show you the error correction. Now suppose an error was made. Again, use an error correction. Here's a video model. And on the error correction, it means she's going to be making an error, and I'm going to have to correct that error and get her back to the star. So let's try that again. My turn. Good job. Now again, she may satiate from this ball, so I want to always assess the motivation. So here I can assess the motivation as I'm setting up my cards. She selected the ball again, so that's what's she's into that. Can I have a turn? Perfect. Say brother.
Brother.
Do this. Do this. Do this. Point to the star. Good. Point to the star. Do this. Do this. Point to the star. Good. Point to the star. Nice work. So as you can see, I had my hand there ready to prompt her to get her to the star, so I'm blocking the other ones from her responding. Now again, whenever you're doing receptive, always make sure that you're switching up the array on the table. Don't leave the star on the right-hand side all the time or on the left-hand side or in the middle all the time. Switch it up so that they're not attending to the location of it, that they're actually attending to the actual star. The other thing is pay attention to your SD. You want to make sure that you're saying things like point to, show me, find the, where's the, and so on. Remember the cards in the array. You don't need to have them in a straight array. They can be in a messy array. Having 3 to 5 cards is good. This will help your learner with discrimination training. Remember though, if you have a learner just starting off, having a messy array and too many cards or items on the table can be too difficult. This should be set up by your supervisor, but something to be aware of. Next is TACT training. Remember what TACT was? Is it an instruction or a label or a request? If you said label, you're absolutely right. You could be using pictures or objects. Again, you could be teaching this by saying, what is it? Prompt the correct response. When you're prompting, you want the learner to engage in the behavior. So be sure that they echo here, which is then followed by a transfer trial, and then you give the learner an opportunity to respond independently. Let's take a look. All right, so now we're going to move on to the TACT. And again, I'm going to assess the motivation. I'm going to put some items out as I'm setting up my cards and getting my data sheet ready, whatever it might be. The learner has selected something, so that's perfect. I'll put my items down. And so now the goal is for me to have the learner label an item. So the picture card that I'm using is a cake, and so they're going to label the cake as I'm going through my teaching. So I'm going to put that there. That's my target. And then I have some receptive cards, and I've got some of my high probability going. So here we go. Can I have a turn, please? You're doing such a great job. Here we go. Do this. Say ba. Say cheese. Cheese. Point to the ladybug. Good. What is it? Cake. Cake. What is it? Cake. Nice. As you can see here, I immediately picked up the card and I said, what is it? And labeled it cake. 0-second delay. She responded cake, and then I used my transfer trial. What is it? And she said cake. Now, if an error occurs, you'll need to use an error correction. So again, each time you may have to assess the motivation, but if I know an item is really, really motivating, I might just use it again for my next trial. All right, say car. Show me the star. Find the ladybug. Where's your head? Say chip. Chip. What is it? Cake. Cake. What is it? Cookie. Say eyes. Eyes. Good. Say ball. Ball. What is it? Cake. Cake. What is it? Cake. Good. And so you can see here she made an error. She said cookies. I don't want to chain cookies and cake. I want to make sure there's a break in between it. So I used some high probability cards, got her to respond correctly. Then I went back to it. I prompted it fully, cake. And then on the transfer trial, I said k. And I gave her just a phonemic prompt, just getting her something to get her started so that she could say cake. Now, cake and cookies is very tricky because she could have said cookies for that. And so even with that, my prompt may not have been enough. And I may have to say something like cake to really get that cake to come out. So be aware of that when you're doing your prompts, and think about that. And speak to your supervisor, of course, if on the transfer trial or error correction you're still getting errors, because that means the prompts need to be looked at. Now, I model teaching in a way where we're programming for discrimination. For example, we can teach multiple domains in one. You can do an echoic, receptive skill, and TACT all in one. Let me show you again. Next, we want to look at discrimination training. And so as you can see, when we're teaching, we want to have picture cards, and I have my high probability cards. We have a lot of things going. But one of the things that you want to pay attention to is really asking a variety of different questions. And so here, what I'm going to do is I'm going to get some more cards out, and now what I'm looking at is I'm really tackling multiple domains at once. And so I might do something like this. Show me the ladybug. What is it? A hippo. What color is it? It's yellow. What number is it? 10. Say ball. Ball. What is it? Cake. Cake. What is it? Cake. Good. So again, here I'm asking a variety of different questions. I asked her to receptively identify things. I had her tact the item, the color, number. So I'm asking a lot of different questions. I'm doing discrimination training. Now, another way to do some discrimination training is with one item. So I have cake, let's say, and this is great because I don't want my learner just to remember this picture as being cake, but I want them to be able to talk about it. So what is it?
It's a cake.
What color is it?
It's white.
What's on top of it?
Strawberries.
And what do you do with it?
You eat it.
And where do you find it?
At the store.
Good. And when do we eat cake?
On a birthday.
On a birthday, very good. So as you can see, now I'm taking one item and I want to see if they can discriminate the questions based on that one single picture that I'm presenting them with. So are they able to answer a variety of questions, or do they just say cake when they see this? So if your learner, if you show them this picture, for example, and they just said cake to you when you said, what do you do with it? And they said cake, then you've got a little bit of an issue when it comes to discrimination and being able to respond to multiple questions with that one picture card. And so this is a good strategy to use when you're working on that discrimination training with your learners. Let's take a look at the intraverbal, the SD, prompt, and transfer trial. Remember here, the picture or item does not have to be present, but we can use it as part of our prompt and quickly fade it. Let's take a look. We're going to be working on animal sounds as the intraverbal, and so here the SD would be what does a, let's say, dog say, and she would be required to answer woof woof. Again, I'm going to assess the motivation in that moment before my trial. I'm going to go through my high probability cards, and then we're going to go through the intraverbal. Now with the intraverbal here, I'm actually using just an echoic. I'm not going to use a picture because I can't really show a picture of woof woof. So here we go. Let me get some picture cards ready. I've assessed the motivation. All is good. Here we go. Touch your nose. Say ba. Ba. Show me the star. Find the number 12. Show me your ears. Find the cake. And where's your chin? What does a dog say? Woof, woof.
Woof, woof.
What does a dog say?
Woof, woof.
Great job. Good. And of course, each time that you are at the end of your trial, give the reinforcer to the learner, ensure that they are engaging in the appropriate behavior or skill, and then mark your data down. Now, depending on how you guys collect data, whether you're taking trial by trial or maybe it's just a probe, you'll mark it down and that's it. And then you're ready to move on to your next skill. Now, if an error occurs, you'll need to use an error correction. Touch your nose. Find your ears. Show me the number 12. Say pizza.
Pizza.
And do this. And do this. Find the cake. What does a dog say? Woof, woof.
Woof, woof.
What does a dog say?
Quack.
Do this. What does a dog say? Woof, woof.
Woof, woof.
What does a dog say? Woof,
woof, woof.
Good. Nice work. So there again, you can see the error occurred on that transfer trial. I went into my error correction, I prompted it, and then I gave a bit of a phonemic prompt there to ensure that she responds correctly. Again, watch for those errors. If you're getting a lot of errors on the transfer trial, then you need to speak to your supervisor about that because that's a little bit of an issue there. Another way of dealing with errors is using yes/no questions and conditional questions. Now, your learner needs to know how to respond to these. Let me demonstrate. So now I'm going to show you another technique. If you are dealing with errors, sometimes when you get to intraverbals and the learner is an intermediate to advanced learner, you can use yes, no, or conditional questions. So let's go to, for example, labeling the cake. So if I said, what is it? And she responded, cookie. Let's suppose that's the response. What is it?
Cookie.
I can go into a yes, no. So is this a cookie?
No.
No. So they're looking at the picture and now they recognize that it's not a cookie. Sometimes they may have just responded very quickly. I don't know why the error happened. Maybe they're not attending. So I can use a yes, no. A yes, no may not always be effective. So I can say something like a conditional question. Is this a cake or a ball?
It's a cake.
It's a cake. So that's good. So I can do something like that. I can, if they made the error with cookie, I may not say something like, is this a cake and a cookie? Because then they may still say cookie. But I can say something like, is this a cake or a ball? And when they look at it, they're saying, it's not a ball, that it's a cake. And so I'm allowing them to use their own thinking, in a sense, to get to that response, as opposed to me always prompting them. So this gets them to just be a little bit more on the independent side. So again, it depends on your learner. You may not be able to do this with early learners, but an intermediate to advanced learner is a very possible strategy to use. Okay, so let's put it all together. When teaching, we need to be sure we're ready for our session. The way we do this is by reviewing our written acquisition plan. Remember, this is a breakdown of what we'll be teaching and how prompt levels will be, and the reinforcement, generalization, and so on. So be sure to review these plans regularly. Now, it's recommended that your supervisor review the plan with you and the team. All right, so now let's put it all together. So the first thing that I'm always going to do is assess the motivation. My table is always ready, and I'm getting my picture cards, I'm getting my program material ready. So they've selected their reinforcer. I'm now going to start going into, into my teaching. Again, having too many things on your table sometimes can be a distraction or a problem. So be sure to always work on the tidiness of your table. I think that's best. Anything that you don't need, let's get rid of it, put it aside. So I've got my receptive cards and TAC cards, and then I have some extra cards here if I need to change up my cards. I've got my tally counters. If she mans for anything, then of course I can click that. I like to intersperse my my manding with my trials as I'm working at the table, so that I'm not just doing it like manding and then you know, another program and another program. I like to intersperse it. And we have a daily sheet that goes through all the different programs that we're working on, and so you can intersperse it that way too. Again, if you have the material that you have, you can rotate it that way too. So let's get right into it. Can I have the ball, please? Great work. Here we go. Show me the number 12. Where's the number 2? What color is it?
It's orange.
Tell me what this is.
Star.
Say brother.
Brother.
Do this. Do this. Do this. Do this. Good job. There you go. And then I can mark my data, and then I continue. All right, check this out. I've got the book and I've got the animal toy. Which one do you want?
The book.
All right. Thank you. Here we go. All right, can I have the book, please? Fantastic. Do this. Show me the number 12. What's this?
It's a heart.
Say happy.
Happy.
What number is this?
2.
What color is this?
Yellow.
Show me your elbow. Good. Point to the cake. Good. Point to the cake. Nice work. High five. You got the book there. Oh, look at the clouds. Do you see that? And what's that?
Dragonfly.
It's a dragonfly. And ribbit. Ribbit says the
Frog.
frog. I wonder what color the frog is.
Green.
It is green. Superstar. Okay. All right.
Have the ball, please?
Sure. Let's swap. I'll take that. And so as you can see there, what I'm trying to do as I'm working with my learner is to embed some of her man targets, and one of her man targets happened to be ball. And so I can kind of switch with her to take the book away and introduce another item, and one of the items that she really likes is the ball. So that's a good way of transitioning. But then I also get my mans in there, and I want to make sure that I'm interspersing them throughout the day. Now you might have an allotted time for manding, which is good too, but this is a nice thing to do throughout the day, and that's why you have your counters, your tally counters there with you at all times. All right, can I have the ball? Fantastic. Here we go. Do this. Say apple.
Apple.
And do this. Find the star. Where's the number 2? What is it? Cake.
Cake.
Good. What is it?
Cake.
Nice job. Now you can see I dropped my card as I was doing the trial. I think this is important to note that you will have those moments where you drop the card, or you will forget to do something, or you will look at a card and it might say it's a receptive and you do it as an imitation. It's okay. Just move on and keep it flowing. And you might laugh at it, and that's okay. I think the most important thing is try not to lose that momentum with your learner. But these things will happen, and I think it's good for you to see it. And we didn't want to cut it out from our video because I think it's just important for you guys to see the reality of, when you're moving so quickly, things can happen. So I hope that was entertaining for you guys as much as it was entertaining for me. Good. So that was a tack that I did. I did my prompt. I did my my transfer trial, and that was a part of that teaching. So I'm just putting it all together for you. And of course, you're taking your data at the same time. If you've only done probes, then you're just going to probe that item. So if the probe was, what is it?
Cake.
Good. So now I've just probed it. I'm not prompting. So let me show you some probes just so you understand what I'm looking at. So may I have it, please? Thank you. So we were looking at clapping hands, cake, and then we were doing some receptive. So the receptive that I'm going to hit here is the number 10. Okay, so let me just clear some of the items. And I just want you to see what the probes would look like. All right. What is it?
It's a cake.
Good. High five. Show me the number 10. Good. Nice work. Do this. Good. So you can see those were all probes. Now you might have a choice of probing everything all at once, and that's how you like to do it to start your day. Just probe all the targets, see what they can do. It's almost like a pretest to see if they still have retained the, from whatever you taught them yesterday, they've retained that those skills and they've learned. If they got no's, then you know that the teaching from the previous day was not very successful, and we have to look and see why. Again, if it's a new skill, it may take them, a little bit of time to acquire it. But that's what the probe would look like. Another way of doing is to probe it, and then if they got it wrong, you can start teaching it and go into that, and then you probe the next one and you teach, and you go that way too. So either way is fine, whatever works for you. Again, you could speak to your supervisor because your supervisor may have a preference to how they like things to run. So that is really up to you and your supervisor. And again, as a RBT, you're going to find your own way, and you're going to find your way of teaching and really becoming that therapist. So I encourage you to find that person within. Selecting program targets will be part of your everyday therapy. Your supervisor may help you set up the programs, but you'll be required to come up with specific targets. Now, you and your supervisor may brainstorm ideas together initially. If you're new, I would suggest that you work closely with your supervisor here. As you have more experience, you'll feel more comfortable setting those targets. Program targets are skills that you'll be working on for that program. If it's an imitation with object program, think of functional things a learner can do with that object, such as banging a drum, shaking a tambourine, or brushing the pony's hair. Select targets that are functional for the learner and make sense based on their age and experience. Don't talk about Tim Hortons if they're 3 years old and have no idea what Tim Hortons is. If they like Home Depot, then you can teach them about tools you can buy there and things that you can find at Home Depot and so on. You want to remember that you want the teaching to be meaningful. Okay, so let's jump into the quiz. Good luck. What is prompting? A, prompting at a 0-second delay. B, correcting an error. C, providing assistance, or D, fading prompts. And the correct response is C, providing assistance. What is a transfer trial? A, prompting at a 0-second delay. B, correcting an error. C, providing assistance. D, fading prompts. And the correct response is D, fading prompts. Remember, this is a transfer of stimulus control, but I often call it a transfer trial. What is errorless teaching? A, prompting at a 0-second delay. B, correcting an error. C, providing assistance. Or D, fading prompts. And the correct response is A, prompting at a 0-second delay. What is an error correction? A, prompting at a 0-second delay. B, correcting an error. C, providing assistance. Or D, fading prompts. And the correct response is B, correcting an error. The RBT is teaching Billy to label book. She asked the question, "What is it?" and prompted him 4 seconds later to say book. Billy is struggling with this target. What might be the issue? A, misuse of error corrections. B, misuse of errorless teaching. C, misuse of transfer trials. Or D, misuse of reinforcement. And the correct response would be B, misuse of errorless teaching. This is when a consequence is delivered contingent on the target behavior to increase its probability. A, error corrections. B, errorless teaching. C, transfer trials. Or D, reinforcement. And the correct response is D, reinforcement. This is when you restate the SD so that you do not chain an incorrect response with the correct response. A, error corrections. B, errorless teaching. C, transfer trials. Or D, reinforcement. And the correct response is A, error corrections. This is when you restate the SD after the prompted trial. A, error corrections. B, errorless teaching. C, transfer trials. Or D, reinforcement. And the correct response is C, transfer trials. This is when you immediately prompt the correct response. A, error corrections. B, errorless teaching. C, transfer trials. Or D, reinforcement. And the correct response is B, errorless teaching. I mentioned Dr. Vincent Carbone's 3 buttons. Let me review this for you. If your teaching is off-balanced, your learner will either escape or engage in self-stimulatory behaviors. Keep your reinforcement and demands balanced. All right, everyone. So I want to talk about target selection. This is a really important part as a registered behavior technician. Now, most often what will happen is, and again, this could depend on your supervisor, is your supervisor will put together the skill acquisition plan, or what I call the program sheet. And this will outline the details of how to actually run the program. So that's a really important part so that you know how to run the program and others can do the same. But what will happen sometimes is your supervisor will have you select the targets, and And I'll go through what that would look like. But I want to just show you guys how I set up a program. Now, again, in your center, if you're doing home-based or if you work at a school, it might be slightly different. So you might do something that is computerized, and you have something on the computer. And so what we do is we create tabs, and that's where all our information is. And then if you use like a binder system, then you might actually have these same type of sheets in the binder. Now, this is a good setup. I've been using it for years and years, and I recommend it to a lot of, centers and people that are starting off with doing programs like this. Excuse me, I'm a little bit under the weather, so please do excuse me. So here, what we're looking at is the program sheet, and then we have a skill tracking form, and this is where we would track all the skills that we're going to be teaching, and then of course our data, and then our graph, and then what I like to add is a supervision notes section, and this would allow the therapist and the supervisor to communicate here, but mainly for the supervisor to write down notes about things that they observed when they looked at the program with the learner, or if something has come up with the RBT and they make notes about it here. So it's just a way to track what's going on with the program specific to this learner. So now let's go to the actual skill acquisition plan. So just as a review for you guys, we've got the learner. And so here, again, depending on your supervisor, they might actually fill this part out for you, or you're going to be required to fill it out. So just be aware of it, and then you can fill it out. And then let's just say this is going to be, let's say it's January 1st, 2019. The program that we're looking at here is an echoics program. So right away, this should, you should think about, what does this mean in terms of what am I teaching? So if it's an echoics program, the learner has to echo my behavior. So just remember that, going back to the verbal domains, what does the program mean? And the reason why I talk about this is because a lot of people will sometimes have a program that they are about to run, and they've read the program sheet, maybe they've been trained on it, but as time passes, people will sometimes skew away from the design of the program, but it's a good reminder for you to always say, what is the objective of this program? If it's an echoic, that means the learner has to echo my behavior. So just remember that. The program here, this is using the ABLES, so we put the ABLES code, and then here they're echoing sounds and words. So the objective, the learner, and so here you can, of course, write who the learner is. Johnny will mimic a sound or word during a fun activity. So that's the objective. So now let's go into what the SD is. So this is what is maybe said, or what's in the environment that would, trigger the behavior to notify or to let the child know that reinforcement will be made available. So, just as a reminder of what the SD is. So here the therapist will produce a sound or word 3 times with a 1-second delay between sounds. So if you were reading this, you would want to be able to understand what the requirement is, or what you need to be doing. So I have to produce a sound or a word, depending on what the target is, 3 times with a 1-second delay between the sounds. So let's just assume the target is ba. So I'm going to say ba, ba, ba. All right. So that's what the SD would, that's what I would understand from the SD. So now let's move on to the next section, which is the response. This is what the learner will be doing. So again, I'm going to put in Johnny. Johnny will mimic the sound or word, or produce an approximation to the sound or word that the therapist provided during an activity. So if I was doing a word, let's just say that was the target that we were working on. Let's say it was bubbles, and the learner produce an approximation to it, then I should be able to accept that. Again, you should clarify that with your supervisor to know what approximations you might be accepting, how close of an approximation, because again, if the target word was bubbles, and the child said, would that be an approximation? What about if they said buttles? Would that be an approximation? So that's something that you can clarify with your supervisor so you know what to accept, and all therapists are consistent, because that's usually where things can sometimes go wrong with the program, is the consistency is off. So somebody's accepting one thing while another person is accepting another thing. So moving on, the mastery criterion. So this is really important because this will allow you to understand when a program is considered mastered. And I always try to bring everybody's attention to this, because sometimes what will happen is, here it says the independent will exceed the prompted. So if I'm looking at the graph and I see that the independent is exceeding the prompted, then I should say that this program is now considered mastered. And often when I do that and I pull therapists in and I say to them, do you think this program is mastered? They'll say, well, no, because the learner is not doing it. Then I question, well, what do you think is going on? How could the independent exceed the prompted? And so sometimes the way that we're running things could actually be incorrect. And that's where it's really important that you and your supervisor sit down and take a look at how are things running? Are the trials being run back to back? And could that be a reason for the learner showing independence when it's really not independence, it's more following prompted trials and so on. But in this case here, we're looking at, I'm going to produce a sound, and then if the learner is imitating and vocally imitating me quickly, then that would be a good thing, because that's what we want. So again, speak to your supervisor if it's unclear to you, but it's important to really look at what is being asked of you so that you know what you're, when you're taking the data and you're graphing this, that you can go back to your supervisor to say, I think this program is close to being mastered, or I think there's a problem with this program or how it's being run because, and then you can let your supervisor know. The revision criterion here would be no sounds produced independently for over 2 weeks. So if the learner is not producing any sounds for 2 weeks, so they're flatlining, then you may need to speak to your supervisor about this to address this problem, and so that it can be revised. If you're getting some production, again, you want to be able to speak to your supervisor to talk about whether this program is moving forward or not, or then your supervisor can really take a look and see and analyze what some of the problems might be. So let's continue. So the teaching here is going to be in the net. We're not sitting, and doing this as a discrete trial, at the table. You can definitely run this at the table. Remember, net is not just on the floor. Net is also on the table and playing at the table. So keep that in mind. So here you're setting up a fun activity such as painting or blocks. You want to identify reinforcing activities here. So this is really important for this program. And that's why it's highlighted here. And again, I like to state that it can be done on the floor or at the table. Again, a lot of therapists, when they think net, they just think floor. But that's not the case. You can do net both at the table and on the floor. So here, we're identifying the social routine, or so here, when we talked about social routines, we talked about having that repetitive type play that is predictable for the learner so that they can, almost anticipate that reinforcer, but then because they anticipate the reinforcer, they might be more likely to make that production for us. So for example, if I was, filling a bucket full of, toy balls, softballs that the learner really likes, and then I was dumping all the balls, and I kept on doing this, fill the bucket, dump the balls, fill the bucket, dump the balls, and the learner is enjoying this activity, then I can fill all the balls into the bucket and then hold it as I'm ready to dump it, but I don't dump it just yet. And then I would say, ba, 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 and dump it. Okay, and so here, because the learner is predicting that I'm going to dump the balls, they might, because now they're waiting and they're hearing this ba, they might at that point then say ba, because they really want that reinforcer to happen. They really want that reinforcing activity to happen. So think about that. If your learner is not producing during this program, then that's where, again, you need to speak to your supervisor, because maybe the reinforcing activities aren't so reinforcing. And so that's something that you and your supervisor can really sit down and look at. And you might say that your activities are very reinforcing and it's really good, but maybe the other therapists that are working with the learner haven't discovered or explored such reinforcing activities. So it's good for you and your team to really sit down and talk about what everybody is doing and how successful it is or not successful, and so on. So let's continue here. So the teaching strategy here is going to be that, again, you say the target sound 3 times with a 1 second delay between each target sound. Again, ba, ba, ba. You're going to provide a small amount of the reinforcer following the 3 presentations if the learner does not echo. So going back to filling the balls in the bucket, I could slowly dump out a couple of balls as opposed to dumping all the balls. So I want you to envision that you have 10 balls in this bucket, and you say, you get it ready and it's almost above your head and you're about to dump it, and you go ba, ba, ba. The child doesn't produce anything, so you dump out maybe 2 or 3 of the balls by shaking the bucket slightly, and some of the balls start to fall. And the learner enjoys this. That's great. You do it again. Ba, ba, ba. Same thing. You shake the bucket and 3 more balls fall out. So that's now 6 balls that have fallen out. You still have 4 more. Technically, you have either 1 or 2 more trials that you could do where you dump out, 2 balls for each trial, or you dump out all 4 balls for the final trial. And then you can restart this. And of course, you would be taking your data here. So now, you've done 3 to 4 trials for that one. If the child did not produce, then you just, you don't indicate anything there. It's going to be a 0 in this moment right there. Then, if the learner actually produces a sound, then you would provide a larger quantity or amount of that reinforcer. So again, going back to the bucket situation, I fill all the balls back into the bucket. I've got those 10 balls in there, and I go ba, ba, and the child says ba on my second presentation of that sound. I would now dump all the balls so that the learner gets access to that reinforcer. So do you see the difference there? The first time that I was doing it, I was providing a small amount of the reinforcer. By the second time, when I was doing, when I refilled the bucket and the learner on my second presentation, said the word or the sound, then I provided the entire reinforcer, really making it more reinforcing. And I could then again fill the bucket and dump it again and do that a couple of times just to really show that because they produce the sound, the access to reinforcement here has increased dramatically, or the access to reinforcers here has increased dramatically. So keep that in mind. When we talk about differentially reinforcing, this is really what we're talking about, is really making it stand out for the learner, that you get so much more if you do more for us. So if they talk, then they're going to get a lot more. If they don't produce anything, we still need to allow them to access that reinforcement, because there's a pairing procedure happening here specifically for this program, okay? So keep that in mind, because this is a program where we're pairing, we're pairing the sound with reinforcement. You are going to have to provide that reinforcer so that they can have access to it. So then, is there a transfer trial here? Not really, because we're just producing the sound, we're providing it. If they produce the sound and they echo, then for sure I'm going to give them that item. And then here, in terms of data collection, I'm going to collect prompted versus independent trials and sounds produced per session. So now let's go to the target selection. So how do you know what to select for your learner? So the first thing I'm going to do is I'm going to put in my learner's name. Now, I don't know why I always do that, but there we go. And then here I'm going to put in what the ABLS code is. And now, when you and your supervisor have talked about this learner, or your supervisor has done an assessment, they should have a list of sounds or things that the child was able to produce. So getting access to that is really going to help you. And sometimes what we do is we add a little table over here where we write down all the sounds that the child can produce. Now, what we want to do is we want to get that under really a echoic control. We want to say ba and then they say ba. We want to say e and they say e. We want to say bubbles and they say bubbles. That's what echoic control is all about. So I want to pick targets here that the learner can produce, but I don't have echoic control over. So if the learner cannot say, let's say, ka, I'm not going to put that as a target. One, ka is a very hard sound to produce possibly, and two, if it's not in their repertoire, I don't want to tackle that. I want to tackle easy sounds. So when we're looking at it from an echoic perspective and child development, what sounds does a learner typically produce initially? So think of infants when they first start producing sounds. What is a sound that they typically start producing? Well, they might produce something like ba. They might produce something like ma. They might have a lot of those vowels, e, oo, ah, and so those are sounds that are really good to start with. So if I'm selecting my target here, then I might select the target ba. So let's suppose that the target sound ba is in their repertoire. So that's good. It is a sound that a lot of children at a young age will produce, so that's good. It's a really good sound because if you produce the sound ba, and try that just now, say ba, you'll notice that your lips come together. So if the learner is sitting in front of you and they're looking at you and you're playing with this fun activity and they of course you want them to be looking at you, then when you produce ba, you can really emphasize, putting your lips together, and so they could possibly even mimic that action, and it'll get the learner producing that sound. So that's something to keep in mind. If you said, something like na, so say na, that's a little harder because the learner can't really see what's happening with your mouth. So that's just something to keep in mind. And we talked about, the linguistic parts and where your tongue and your lips are. So, that's something that you can keep in mind when you're selecting targets. You want something that the learner can produce that's easy. Now, another sound or another, a sound that children produce when they're very young is something like ma. And you'll see that a lot. They'll go ma, ma, ma. So that's another great sound that you can add, and if they have it in their repertoire, then that's great too. Now, the only problem here, and this is what I really want to get to with target selection, is when you're selecting targets, you don't want to select targets that are too similar, because it can be very hard then when you're teaching, you can't discriminate which one that they're working on or what they're producing. So here, for example, if they were doing ba and ma, well, the difference between ba and ma is the ma is a nasal sound. So again, we've talked about this. And so if the learner doesn't allow for the air to come out of their nose, then that ba and ma is going to end up being the exact same. So they might end up saying ba 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 for ma ma ma. And then you can't discriminate which one they're doing, and you don't know how to count it. It's going to end up being a ba. So I would stay away from things that seem similar. But again, you need to know what makes them similar. So, when we talked about where these sounds are being produced, then you know that, okay, the location and the lips are all the same. So putting, ba and ma as targets running simultaneously may not be the right choice. So that's something to keep in mind. And so before you select the targets, just think about it for a moment and think about, are they similar? Are they in the same location? Are they do they sound the same? Do they look the same? Keep that in mind when you're selecting targets. And I'll review this as we go through a few other programs throughout the course. So ba and ma, they'd be too similar. So let's assume that they have, an E and an oo sound in their repertoire as well. So let's say that we're going to select, the E sound. And so this is going to be a prolonged E. So now ba, E, very different. Even visually, when you look at, someone saying E versus ba, you can give it a try. It sounds different. It looks different. That's a perfect target to go with. What about, let's say oo? Well, again, ba, E, oo. Very, very different. So these would be great targets to start with. So depending on how many targets you're supposed to select, sometimes your supervisor might specify. If you're not sure, then speak to your supervisor about how many targets should we select for this program. I'm assuming because we're doing an echoic, SSP type program, this is a very early learner. So, selecting 5 targets may not be the right choice. 2 to 3 targets is probably the best, but it also depends on how much time that they're doing in therapy. If they, if you see them for 2 hours twice a week, and they've got, 5 other programs, they may not be getting a lot of time with this program. So you want to think about that before you select too many targets. So if they're doing 2 hours and they've got 5 programs, if you gave each program 15 minutes, 15 minutes for 4 programs would fit, equally. And if you wanted to repeat all the programs so that you get repeated trials, well, then you're only doing those 4 programs twice in the hour. And again, you have to look at how many trials that you're able to do in that 15 minutes. So if you are only doing 5 trials in that 15 minutes, well, that's not very good because they're not getting a lot of practice. So again, you have to look at, in the 15 minutes with this kind of program, how many trials can I possibly do? So if we practiced it right now, let's take a look at how many trials could you possibly do of ba in let's say a minute. So I'm going to do it, and I want you guys to count. Okay, here we go. Ba, ba, ba. 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 So that was about a minute. So you could see that in a minute you can get quite a few trials of, an SSP type program, this echoic type program. Now, the reason why I had a little bit of a pause after my 3 trials was because I'm assuming that I'm delivering this reinforcer. So if it was an edible, then I would produce ba, 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 and then I would reinforce by, let's say placing a small piece of the, let's say it was a cracker in their mouth. Now, if they produce the ba sound within those, 3 trials, anytime within those 3 trials, then I'm going to reinforce right away with probably a larger piece. So if I said ba and the child echoed right then and there, I'm going to stop and I'm going to give them the reinforcer there. I'm not going to continue producing the ba sound. So that's something to just keep in mind as well. So this is very, specific to the SSP type program and teaching children to vocalize and getting that pairing process going. So I to recap very quickly, specifically for this program, you want to be able to pick targets that sound and look very different. And this goes obviously across all programs, but specific to this one, something like ba, e, oo, very different. They look different. The lips are moving very differently. Let's say that you were giving this program 15 minutes of your time. You can see, I don't know how many trials I did because I wasn't counting as I was doing it. So, but you got the idea of what I was trying to say. You can get quite a few trials in this, which is really what you want. It is about the number of trials that you guys can fit in, but it's also about the value of that reinforcer and how powerful it is. If the learner has satiated from that reinforcer that you are using, it will not be effective and you will not get sound production. If you are using a reinforcer and you're giving large quantities every single time, whether the child is producing or not, then the learner will say, well, whether I produce something or not, I get that full cracker, so there's no point in me producing the sound every single time. But when there's that differential reinforcement and you get a small piece versus the large piece, well, I'd rather get the large piece over the small piece. And this actually happened a very long time ago. When I was first introduced to SSPs, I went to a conference and they were talking about this, and I was fascinated by it. I thought, wow, I have so many learners that are not talking. I really want to incorporate this into our practice. And so, I went back to work the next day and I went to my supervisor and I said, how they were talking about this SSP thing, can we please get this started for, my learner, this one and that one. And she was like, yeah, of course, let's get it started for all the very early learners. And so at that time we were required to do 1,000 trials. And so we actually had a data sheet with 1,000 boxes and we had to do the 1,000 trials. It wasn't based on time. It was just based on trials. And so, day after day, I did this with my learner, and he loved Dorito chips. And so I would give him a small piece of this Dorito chip. And, I think his sound was ooh at the time, and I would say ooh, 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 and put a piece in his mouth. Ooh, 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 and put it in his mouth. And then one day I was, after several days and we were just getting nothing, I looked at him and I said, okay, if you want the big chip, and I was holding this big Dorito chip in front of him, and I said, if you want this big chip, you've got to say ooh for me. And so I did it. I kept on going ooh, ooh, ooh. And then, probably like in the 5th trial or 6th trial, he said ooh. And I gave him the whole chip and we celebrated. And I was like, wow, like I can't believe it. Like, I don't know if that was just a fluke or what that was, but obviously the number of trials and the patience with doing a program like this, you need that patience. And I think that's what I'm trying to say is, if you do a program like this or any program, sometimes you're not going to see the progress in a day or in 2 days. But if you don't see progress in a couple of weeks, then that's where you really need to speak to your supervisor, because we want our learners to be making progress every week, every couple of weeks. We want to see that progress every single day. And so if your learner is not making that progress, then speak to your supervisor and then really go back and assess, why is my learner not, doing the target skill? Is it my targets? Is it the reinforcer? Is it, is it the way that I'm reinforcing? Is it the differential reinforcement? Is there something in the room that's distracting, that's, not allowing me to, to get the success with my learners? So these are things that you really want to think about when you're thinking of, teaching your learner and getting that very successful therapy session in there. So that's something to really think about and to, again, discuss with your supervisor when things are not moving in the right direction. So to wrap this up, finally here you've got your data section. And here you would be indicating, the number of trials that you did. So let's assume in a 15-minute chunk of time, you did 55 prompted trials, and, let's say they did 3. So now let's just go to my graph to make sure. I'm just going to do one thing. I like to always, if you're using computers, and I'm not sure if, you guys are, I always like to skip the first line, because then when you go to your graph, it actually shows it, not on your axis, but just after that. So that's really what I like to do. So you've put in your information, prompted versus independent. You go to your graph. Now, I like to always double check the graphs to make sure that it's written up, properly. So here we're looking at prompted versus independent. Now, the only thing that's missing here in this graph, as you can see, is I don't know which one is which. So if you're using, a Mac, then you would be using numbers. If you're using Windows, then you're using Excel. So I'm not sure how Excel works, but, I like to add the legend, and then, of course, you'll have that there. Now, for some reason, this one is not showing. So I always go back and I just check my work to see what's going on, and I think that's what this is. So if I delete the series, and that's just the way, if you're using a Mac, how it gets fixed. Let's see if it fixed it for me, and it did. So I guess what happened here is it wasn't right at the top, so it didn't highlight prompted for me. But now that I fixed that, and just to show you again, if you're using a Mac, the way that I do it is I just delete the series, and then I just click on the top here where it says prompted and independent to re-highlight those areas. And then, as you can see, everything is back to normal. I press done here, so nothing else changes. And now I have my legend here. And so now I know, whoopsie daisy. Now I know which one is prompted and which one is independent. And so I can see that here's my prompted and here's my independent. Perfect. Okay. So that is, I went through going through the program sheet for this one. I went through selecting targets and knowing which targets to select, and really making sure that they're different. We talked about reinforcement here. We talked about differential reinforcement here. And if your learner is not learning, be sure to speak to your supervisor. We went through the data here, and of course you would write the date. So let's just say if this program, I think, was introduced January 1st, then that's my first date. And then it appeared here, which is perfect. And again, you want to fill in the proper sections, if who your learner is, what the program is, and so on. So that's selecting targets for a program like this. And again, this is a pairing type program, where you're pairing sounds with reinforcement. So that's it for this one. All right, everyone. So now I'm going to take a look and show you guys a different program and setting this one up. It's slightly different, so I just want you guys, again, to get that practice. So here again, we have the learner. So I'm going to use my Johnny little guy, and then we're going to put the date. We're going to say it's January 1st, 2019. And now here again, the domain. Now this one is imitation. Now the supervisor can definitely specify it and make it clearer to you that it's motor imitation and it's not vocal imitation. So that's something that can be done. However, if we look at the next one where it says D1, we know that D is motor imitation. And so we would know that there's something that it's not vocal imitation. And here we're looking at imitation with objects specifically. And if we look, and of course, if we look at the objective here, again, sorry, I keep misspelling things today, is Johnny will copy an action with an object during an activity with a therapist within 3 seconds of its presentation. So what does this mean? So he's going to copy an action, or the learner is going to copy an action with an object. So they have to have something while they're engaged in this activity with the therapist. And they have to do it within 3 seconds of its presentation. So, for example, if I was playing with the drum and I was banging, like the stick onto the drum, and the learner would have to do the same action within 3 seconds of its presentation. So if they did it after 10 seconds or 15 seconds, that would be considered incorrect if we were taking probe data. We'll continue on and take a look. So the SD for this one is the therapist will model an action. The other thing that I would probably add to this is that it's specifically model an action with an object. And I think that's important to put down. And so sometimes when you're reading a program sheet, it's important that you really look at it and want it to be as detailed as possible. So if your supervisor is missing any information and there's that question mark of, well, you know, what am I doing? I mean, clearly this one is with an object, but again, I like it to be as crystal clear as possible. So, you know, that's something that you can speak to your supervisor about. And of course, I don't know why I spelled learner wrong here, but anyways, here you're going to put the response criterion would be that Johnny will mimic the therapist's action with an object during an activity. So that's what's required for the learner to do. It's very much like the objective, and so you'll see that it almost seems a little redundant, but this is what we're expecting the learner to do. Now let's look at the mastery criterion, and here it's saying, so it's different than the other program that we saw where it was independent exceeds the prompted. Here we're looking at 3 why probes over 3 consecutive days. So they need to get 3 yeses over 3 consecutive days. And the other thing that I would add to this is that it also has to meet generalization criteria. And the reason for that is if we quickly just go down to the generalization criteria, it says that it's across 3 ITs and 2 different environments. So it could be home and center, it could be different places also in the center. That's just something to keep in mind. And so when we're looking at 3 Y probes over 3 consecutive days and meets generalization criteria, we need to ensure that it's not just 3 Ys, like 3 S's over 3 days, but it also is with at least, let's say 3 therapists. Sometimes, you can have it down to just 2, depending on how many people work with the learner, but that's something to keep in mind. And then the revision criterion here is one thing actually before I continue on is I like to actually add, and this one doesn't have it, what the ABLE's mastery criterion is. So for this program specifically, if we looked at the ABLE's, you'll see that it's 10 actions. Oopsie daisy, actions with objects. So if the learner has the 10 items, then we can say that this program is potentially mastered. And so that's just something to keep in mind when you're running this program. And so this would tell you when to approach your supervisor. So you'll go to your supervisor and say, Shaz, I just want to let you know that Johnny has actually mastered 10 actions, and I just want to know if I'm ready to master off this program or not. So that's a conversation that you could potentially have with your supervisor in regards to this learner in this program. Next, we have the revision criterion, which is here. Now, every program and every supervisor will potentially have it different. 5 no probes over 5 consecutive days. So what I like to do is if a program is not moving, within about a week or so, depending on the learner and how many times they come to us per week, that we're taking action. So I like to talk in days, rather than weeks, because a learner might only come to us twice a week. So 5 sessions of theirs, 5 consecutive sessions. If they're not making any progress or it's all no's, they need to come and speak to their supervisor to get this addressed immediately. So keep that in mind. Next is, the teaching strategy. So here again, this one might be in the net. Again, you can do this at the table or on the floor. Errorless teaching is use a physical prompt at a 0-second delay. So when we're using errorless teaching, again, I'm going to prompt right away without allowing the learner to make a mistake. So if I am, let's say, shaking the tambourine, then I'm going to quickly prompt the learner to shake the tambourine. I'm not going to wait 5 seconds for them to, shake the tambourine. I'm not going to wait 10 seconds. I'm going to prompt immediately. And the reason why I want to prompt immediately is so that I can get this behavior under control, so that I could reinforce it. And of course, I'm going to do a transfer trial immediately after. And here I'm going to model the action again and wait for the learner to copy the action. If the learner copies the action, reinforce immediately. If they don't copy the action, then of course you're going to run an error correction here. So if they do it and they shake the tambourine, let's say, then you're going to reinforce immediately with whatever the reinforcer may be. So what does this tell you? You need to establish a reinforcer prior to teaching. Shaking the tambourine may not be the ultimate reinforcer. They may like the tambourine, but you might need to establish other reinforcers, such as, maybe you're using edibles, maybe you're using, music or a movie, something else. If they like the tambourine, that's great, but do establish your reinforcer prior to teaching. And again, this is a major mistake that happens in teaching. A lot of therapists will start running their program, they'll start running their trials, and then, they're saying, well, the child's not sitting for me at the table, or the child is not doing it for me, and I'm not sure why. And I always go back. My first thing is I always go back to, let's take a look at the reinforcers. Let's take a look at how you're reinforcing, the differential reinforcement, everything that has to do with reinforcement. And most often I find that people will forget to establish the reinforcer prior to teaching. So make sure that you establish that first and then go into it. So if they don't copy your action, you're going to go into an error correction. And remember, the error correction is here, you're going to restate the SD, and it's going to be followed by a transfer trial with an embedded partial prompt. So if it's shaking the tambourine and I'm using a full physical prompt, I do that first, and then I run my transfer trial. The child gets it wrong. They don't shake the tambourine. They just maybe touch it. So then I'm going to do an error correction after that. I'm going to prompt them again, shaking the tambourine, and then I'm going to model it for them. I'm going to have them hold the tambourine, and then I'm going to give them a slight partial prompt by maybe getting their hand started, at the wrist by shaking it and then letting go, so that they engage in the behavior independently for a little bit. So with the full physical prompt, I might be, my whole hand is on top of their hand, physically guiding them. But on that error correction, that partial prompt there, I'm just maybe holding their hand at the wrist. Now, sometimes you might find that when you're running a program like this, the learner may drop the item that they're supposed to be doing. So let's say it's the tambourine. They end up dropping the tambourine. So you might have to, the wrist partial prompt may not be sufficient enough, and you might have to go in, where their hand is. But again, maybe instead of placing all your 5 fingers on their hand, you only place 2 fingers, something to start fading that process. But again, if you're having difficulty with a program like this, it's really important that you speak to your supervisor. All right. So then, of course, reinforcement is any time that you are introducing a new skill, you always want to reinforce it immediately. You want it to access reinforcement. If you don't reinforce, then your child or the child that you're working with is not going to produce that skill because it's not coming into contact with reinforcement. So keep that in mind. Now, depending on how you're reinforcing, you might be using, a token board, you might be using a clicker, you might be, providing the actual reinforcer. Whatever that reinforcer is and however you've established it with your supervisor, be sure that you follow those directions. And then the data collection here is that we are collecting probe data, and we're going to graph cumulative number of skills acquired per week. I'm going to make a correction here. Okay, and so that's what the data collection and graphing would be. And again, your program sheet should have this information for you, because how else will you know how you're going to graph this? So speak to your supervisor if this information is missing, and if it's there, then be sure that you are graphing it in that way. All right, and then we talked about the generalization criteria in here. All right, so now let's go on to the next part that we add here. So if you recall the SSP program that we went through, I didn't have a probe data sheet because I wasn't collecting probe data for that. For this program, we have probe data, so we're going to have that sheet included here. And this is just an example of how we have our probe data sheet. Again, if you are doing paper and pencil, you might actually have yeses and nos on your probe data sheet. So again, that might be set up by your supervisor. If you have any questions about, data sheets or how to set one up, or, again, you might be running a home-based therapy type session, and your supervisor comes in and it's more focused on, let's say they're teaching you something else, and you're not sure, and you have to set up these the probe data sheets or data sheets, feel free to send me an email, and, I can share some of the data, data sheets that we have, that we've used. But this is an example of one really easy to create. And so here what I would do is I would write whatever the targets are. However, we don't know what the targets are just yet. So I'm going to go to the skill tracking form. And so here I'm going to write the learner's name, and I'm going to write that it's a D1 program. So now here we go. Target selection. What do I select for this learner? Well, I like to select things that are fun to do, especially because this is an imitation with objects. This is probably a learner that is more on the early learner side. So I want to pick things that are fun for them, that they would actually join me with. But I'm also thinking of, play skills, and I want them to be able to possibly play with these items. So, I might have something like, bang on the drum. And this is, something that, kids like. They like musical instruments, so that might be something fun that we can do, again, if they like those kinds of things. And so, of course, again, when you're assessing reinforcers, you might observe that they go towards the drum, but they don't really know what to do with it. So again, this is a great thing to teach them how to interact with different objects. So, but again, remember this program, what is the objective? It's an imitation program. So the objective is that they imitate what you're doing with the item. So keep that in mind. Another one that I like to do is, oopsie daisy. Is shake tambourine. So this I find a lot of kids are like shake maraca. Those are really fun targets to put in, because you can do the imitation, and then in between my trials, usually what I like to do is do something fun with that activity. So let's just assume that we were shaking the tambourine, and that was my trial. Do this, they do it, and then I say do this. Let me just go back one quick second. Something that it just occurred to me right now. In the SD section, which I didn't put, is okay. So I didn't have this in here, and that is an important part of the SD. Is what to say, but I don't like people to just use the same SD all the time. So they might say, do this, which is fine, but then I want them to vary it, so they can say something like copy me, do what I'm doing. So just keep that in mind when you're teaching a program like this. So so there's the SD, which I forgot to put in there for you guys. But again, that's a really important thing, because as a supervisor, things sometimes will get forgotten and they won't put something in. And so have that conversation with your supervisor and just go back to them and say, I see that you have the SD here, but I'm not sure if you want us to, say do this or copy me, or what were you thinking that you wanted us to say for this program specifically? Is there anything that you had in mind? And that's just something that you can have, again, that conversation with your supervisor. So back to the tambourine here. I'm going to shake the tambourine, say do this. I'm going to go hand over hand, have the learner do it, and then I'm going to do my transfer trial. I'm going to model it, and I'm going to see if my learner will do it independently, and then go from there. Once we're done the trial, then I like to play a little bit with the items. So I might then shake the tambourine and sing a song. If you're happy and you know it, clap your hands, and I might, shake the tambourine as we're doing it, and have the learner do the action with me as we're singing. So having two tambourines would be a good thing. And then going into something playful and fun after your trial is also nice. So that can be a part of that reinforcement time. Excuse me. So suppose you gave them, let's say they really like their edibles, and you gave them, a piece of cracker for engaging in the correct behavior, and then you go into that song. So that gives them a little bit more of that time. And again, you want to speak to your supervisor about the reinforcement time that the child is getting. You don't want the child to be in reinforcement for 5 minutes after doing one trial. That's really, really long, and you're not getting a lot of trials then done in that time. So you might give them 30 seconds to a minute. Sometimes that's really short depending on the program that you're running or the amount of work that they're doing for that trial. So again, speak to your supervisor about that and discuss how do I, how much time do I give them? How do I know how much time to give them? And they should be able to guide you. But, you have to think about it that if they're doing, let's say 3 seconds of work, getting 5 minutes would be a lot of time. If they're doing 20 minutes of work and they get 5 minutes, that might be okay. If they let's say they were doing an academic type program and they were doing an IAS type thing and they were going through bins and folders and they had to do 20 minutes worth of work and they were on task and they did the job, then, maybe getting 5 minutes at the end of that is ideal and is realistic. But, doing something for 3 seconds and then getting 5 minutes of a break doesn't seem very realistic. So keep that in mind. So what are some other targets that you can add for an imitation with objects program? Let's just take a few moments and think about it. Think about, what your learners play with, or, what the child that you work with plays with. And maybe think if you don't work in the field currently, then just think about children and what they like to play with. So another one that I typically like to do, and again, this depends on the learner, if they like to do some pretend play. So we have a lot of learners that like to pretend to talk on the phone or, make believe that they're feeding the baby and stuff like that, which is really good and something that you really want to incorporate into your therapy. And, that play type, imaginative play is, you might do drinking from a cup. So you might be, playing and you're pretending that you're having a tea party, and then you pick up the cup and you go do this, and they take their cup and they do the same. That would be the ideal, thing in that moment there. So when you're thinking of the targets, you do have to know your learner. So really do get to know them and get to know how they like to play and what they like to do. If they like to play with cars, then so you might do something like car down the ramp, and what they would have to do if you have one of those like garage car ramp type things, then you can put the car at the top, and then you would go, do this, and the car goes down, and they would do the same. What else could you add for an imitation with objects program? So another one might be, feeding the baby. If you have like a pretend baby doll, then you could pretend to feed the baby. So again, these are some examples of targets that you could select. Again, now when we talked about the SSP, we talked about don't do things that are too similar or, in the same location or things like that. So when you're doing something like this, if you did shake tambourine and shake maraca, those are very similar because they're both shaking actions. That might be okay because one might actually reinforce the other and almost, get the other skill happening. So I don't think that would be a problem because, again, the SD that you're using here is do this. You're not saying, it's not a receptive, shake the tambourine. And then if you had, let's say, the tambourine and the maraca in the same array, and you said shake the tambourine, and they picked up the maraca, then that would be a problem, and you might then, panic and say, oh my goodness, they don't know the difference between maraca and tambourine. But that's not the test here. The test here is, can they copy your action with an object? So realistically, you can take any object that they like to play with, whether it's Lego blocks or, if you have those stacking boxes or any type of pretend action, such as stirring a cup, or like something that's in a cup, or putting something on top of something, then that's fine. So when you're selecting targets like this, watch what your learner likes to play with. See if you can put those into the imitation, because then when you go into, creating a net lesson plan, remember we talked about that, putting in the targets are going to be so easy, because you know that your learner likes to play with the stacking boxes. And now all you have to do is do an imitation with the, putting the small box on top of the big box. And you would say, do this while you're playing with the boxes. So now you can incorporate your targets right into your net lesson plan. So think about that, and we talked about that. Think about that when you're setting targets for a program like this. All right. So, again, this program needs to have at least 10. Now, again, 10 is the criteria for the ABLES in order for the program to be mastered. But you also want to ensure that the child that you're working with can readily imitate any action with objects. So if you took a novel item and you tried to do an imitation with that and they couldn't do it, then the question is, have they really learned the skill of imitation with objects? And, I always ask people this question is, do you really believe that they can imitate any action with any object? And if the answer is no, then I think we need to continue working on this program. If the answer is yes, if you can take any action and, any item and do something with it and they copy it, even if it's taking, a block and putting it on your head, or, taking a block and pretending it's binoculars and looking into it and having them copy that, then I think you're good to go and you can stop the program. So again, this is something to talk to your supervisor about, but just because the criteria is 10, it doesn't mean that we stop there. These are numbers that are put out there so we have a place to stop and end, or, at least work towards. But if the learner cannot imitate, and that, again, this is what we're tackling here, if they can't do it, then you may really need to go back and revisit imitation and see what's going on. And what you want for them to do is to imitate readily any action that you do with an object. Okay, so I hope that was helpful. And so I've given you 5 for this one. I want you to come up with 5 more on your own. Just think about the learners that you work with, or kids in general. Come up with some targets, put them in there for yourself for the future, so that when you go to, add targets, the behavior of selecting targets becomes a lot easier for you. And then, of course, here, let's go to the data. Now, with cumulative, we talked about graphing that. We're really looking at, per week. So if we go back to the probe data sheet, now we can actually select our targets. So we can put bang on drum, shake tambourine. What was my other one? Drinking from a cup. So let's just say I'm only going to have 3 targets for this one. Okay, so you've got your targets now. Now we need to go back to our probe data sheet to put the targets in there, and there we go. Bang on drum, shake tambourine, drinking from a cup. I'm only going to put 3 because this is an early learner. They've got other programs potentially that they're working on. Again, you're going to have to speak to your supervisor about how many targets does this learner get for this program. So here are my targets. Now, when I'm filling in the probe data sheet, let's just say what we do is we have a sheet that we use, that is on the floor, that is paper, and then we transfer that information onto each and every single program so that it's filed electronically. So let's just say that this program was introduced January 1st, and I'm going to put my initials, and let's just say the learner got a no, and a no on these probes. So that's fine. So then on day 2, we come in, and it's going to be, let's say it's me again, and it's going to be a yes, yes, and yes. Now let's say on January 3rd, same thing. It was a yes, yes, yes. And on January 4th, it was me again, and it was a yes, yes, and yes. So remember, our program sheet said 3 Y probes over 3 consecutive days and meets generalization criterion. So did we get the 3 Ys over 3 days, 3 consecutive days? Yes, we did. So that's perfect. So is this are these targets mastered? Well, the answer should be no, because it does not meet generalization criterion because I ran it all 3 times. So that means I need to ensure that somebody else runs it. So when you are looking at your probe data sheets and you're updating your sheets or whatever it is, however you do, whether it's on computer or paper, you want to look at who's been probing it. So if I got to, let's just say it was, so let's just say on January 4th, I was the only therapist there that day and I had to work, whether you put the data in or not, again, speak to your supervisor about how they want it done. But now let's just say on January 5th, I come in and there's another therapist. So I say, hey, Jenny, I need you to run the imitation program because I already have 2 consecutive days of yeses, and I need, let's say a second person. If you need 3 people, then you have to get that third person. So I actually prefer only 2 people, because I think if 2 people were to run it, then that would be sufficient enough. Otherwise, we have to get all 3 days with different people. So now let's just say Jenny comes in and she, gets all yeses, doesn't meet generalization criteria, doesn't meet the mastery criterion. Yes, it does, because we have, let's say, the 2 people, 3 consecutive days. So these are considered consecutive, even though we've missed January 4th, that's okay. It's still consecutive days. I'll show you what, if it wasn't consecutive days, what that would look like. So let's assume here on January 4th, somebody else runs it and they get no. And then on January 5th, Jenny comes and she does it and she gets yes, yes, yes. So is that mastered? No, because we don't have 3 consecutive days. We actually had someone else who ran this program and they got a no with that person. So we have to continue teaching. So now let's say on January 7th, somebody, let's say it was me, came along and I got yes, yes, and yes. And then let's say on January 8th, or let's say 9th, let's skip a day just so you guys understand that it doesn't have to be, days as in 6, 7, 8 consecutive, but the consecutive days that the individual comes and that the program ran. So let's say here, now it's somebody else and they got yes, yes, and yes. So now we look at this and we say, okay, 3 different people actually ran it here, 3 consecutive days sessions, and we actually got yeses on all of those. And I don't know why that does that. It's silly sometimes. Actually, it should be in the middle. There we go. Just little things I like to fix. And then that's it. And so then here, what we like to do is we like to highlight that this one is finished, and so that's how we would do that. So you can actually do it for all of those, because now all of these are mastered, and you can even write like acquired, just so that they know, or short form for acquired, however you want to do it, that these targets are acquired, and it's done. So now when we go to so our skill tracking form, so again here, this is something I'll review with you guys, is you got to fill in your information. So this was introduced on January 1st, and so is this one, and so was this one. Now you can actually leave these blank because they haven't been introduced yet, but you have selected targets in the future so that you're good to go. You've got stuff set up and ready to go for the next time so that you're not thinking about it the next time. I actually like to set targets in advance. So you can do that and put them there, but don't run them, and try not to run, at least I don't like to do that, because then it's really hard to follow when you're looking at the skill tracking form. For example, to add these 3, and then you add, this one here, let's say, and then you add the one down here. Just keep it, consecutive in that format. And then of course you're going to write the date mastered. So if we go back, the date that it was mastered was January 9th. So here I'm going to write January 9. Same thing for this one. And same thing for this one. Okay. And so now here, number of probes. So how many probes did it take? 1, 2, 3, 4, 5, 6, 7. It took 7 probes for these to become acquired. And so I'm going to put that in. Okay. Now generalization location. This is something that we add on our sheets, and we just like to ensure that the target has been generalized outside of our center. So we usually tell the parents to run it at home, and then we can put that information in there. So now this is all done. So then if we go to data, let's assume that, I'm going to skip a line, January, the first week, let's say, ends on the 5th. Let's just assume. I'm not looking at a calendar, so I'm not doing this in that format. But let's just say it ends, or let's just do it by 7 days. Let's assume that, just to make it easier for you guys, that the end of their week was on the 7th. Okay. If we look at the probe data, they didn't master anything at the end of that week. So we go to data and we're just going to put 0. They didn't master anything that week. We're going to go to our graph to double check cumulative number of skills acquired per week. Perfect. Now this is going to 100. Someone set this up as percentage. We don't want that. So again, if let's say your supervisor set it up, or if you're setting it up, then you want to change it. We really only need 10. So I'm going to put 10 here. But again, if we're going beyond the 10, then we can add more. The minimum is going to be 0. So that's fine. So now we have 0 on the week of January 7th. So with cumulative, we're only graphing it once a week, remember? So now we're going to go back, and the second week, on the 9th, they actually acquired the 3 targets. So if we continued, let's say we added, let's go back to our skill tracking form. So now on January 9th, these 2 were added. Okay, and so they're going to run, so it's car down ramp and feeding baby. Okay, and so these ones, I'm just going to put a little dash through them because they're not going to run. Now, I put only 2 because I have 2 spots left, but then I could go on to the next one or add a row because I still have spots available here. So now on January, let's say 10th, we did it again. So let's go back over here. So the end of that week, let's say, is January 14th. We're going to go back to our probe data for a moment. And now let's say it's, whoopsie daisy, me. And let's say this is how their week went. And it might be somebody else. Let's say it's, so here, let's just say they got a no, and they got a yes, no. So now we're going to look and see what did they acquire at the end of January 14th. We know for sure they've acquired 3, but did they acquire any more? No. So now on the data, I'm only going to say 3. Okay. And now we're going to look at our graph, and it's gone from 0 up to 3. So with cumulative, you're graphing it per week, and it's going to go up, and you might get, a little bit of a flat line sometimes, hopefully not, and then you go up, and it keeps going up like that. And that's how that might go. And of course, if you get a flat line, again, depending on what the revision criterion states, let's go back to ours to see what it stated. It says here 5 no probes. The other thing that we could add is or 2 weeks of a flat line. So if you get, oopsie daisy, if you get 2 weeks of a flat line, or if let's say it was 5 consecutive no probes, then you might speak with your supervisor. So again, you want to pay attention to the criteria, because if that's what you're looking at and you see that you have a flat line, then you want to be able to address that with your supervisor and not let the program continue to run with no progress. So you do have to analyze and look at the graph so that you could see. So if you saw something like this, I'm just going to do this we're going to say January 21st, and then we're just going to go into like February, let's just say, okay? So if you saw my mistake. It can't go back to 0 because that's not cumulative. And this is great for you guys to see. If you're putting it into the computer like this, again, using numbers, this is how it would have to be set up. You keep the number the same. And so then that's how you would get your flat line. Remember, cumulative graphs never go down. So if you saw a graph like that, let me just model that for you again. If you saw something like this, then this is incorrect. This would not be a cumulative graph. Something went wrong here. And so if you did see this and you see cumulative, then you should be questioning what happened. And usually it's just an error in putting things in. So it's great that we're going through this because I see this a lot. And so that's what a flat line would look like on a cumulative graph. And so this would be, 1 week, 2 weeks. So really a therapist should have spoken to their supervisor at this point. However, it ran for another, let's say 2 weeks after that, which is not a good thing. We never want to see a flat line like that. So by the second week, when you're here, then you should really be talking to your supervisor so that they can start coming to address the issue and the problem. And then, of course, here you have your supervision notes, and that's where the supervisor might say, Jenny approached me and told me about the imitation with objects program has flatlined, and I will be observing it on Monday. And so the supervisor would then come and observe it, and again, make a supervision note based on that. So again, here's another program for you that we went through, selecting targets, how to actually inputting the information, really bringing everything all together for you. Because remember, as an RBT, you've got so much responsibility. You've got a responsibility to teach the children or the individuals that you're working with. You've got a responsibility to keep their data, up to date and inputting the data and making sure that you're doing things correctly. But you're also possibly looking and analyzing some of the data. And if you see things that are incorrect, that you want to bring it up to your supervisor immediately. Going back to the graph, if you saw that flat line, or if you saw, your cumulative graph dipping or something, then you want to be able to speak to your supervisor or correct these problems and let your supervisor know that, maybe somebody on your team is graphing things incorrectly, or they don't know all the rules, or they're in the process of becoming an RBT and they're still learning, which is fine. You just want to be able to support that person too and teach them the right way to do things so that you can ensure that your client's information is up to date and graphed accurately.
Keep your session flowing and fun. Don't lose focus by chatting with others or having lots of downtime. Keep your learner engaged by singing, dancing, and learning. Every moment should be a learning opportunity. Don't hit targets back to back, and don't turn everything into a teaching trial. Manding for their program targets and then manding for everything else they want, that could become a problem. If you have selected 5 targets, focus on those 5 targets. Everything else can be a freebie. Label it, but give it freely. Prompt difficult responses, fade those prompts to allow your learner to be independent. Mix and vary those responses. Using high probability request sequence is a great antecedent strategy. Be sure your speed is good. Avoid saying good job after each acquired skill. Then end off on that difficult new skill you're teaching. And most importantly, watch your learner's progress. If they're not learning it within the session, something may not be right, and you'll need to speak to your supervisor about it. Don't let things run for days and weeks without it being addressed. Until the next time, keep on practicing and have fun.